Mm. So like every time we start, we start by marking our margin. So using a wax pencil to mark our margin. Once we have the margin marked, we're gonna use a lubricant. And the purpose of the lubricant is to um, not let the wax get stuck to the dye, okay? Then we're gonna dry it out. And we're ready to start. So this is the tooth that we need to copy. Before we start any wax up, it's good to take a look at the features that we need to duplicate in the wax up. Um, and also the proximal and the occlusal contacts, okay? So as always, I start by adding a thin layer of wax all around my prep to kind of create a little support when I'm gonna start doing the build up. Okay. Once I have that wax structure underneath, I can put my die back into the model and then I can start building up. So I like to start by building up the marginal ridges because the marginal ridges, they give me a guide for the length of the crown and also on the buccal surface and the lingual surface. So it's kind of like a guide for me um, to know how far I can bring my wax on the buccal and also on the lingual. It's not recording. Okay, I'm recording. So as soon as I have the recording done, I'm gonna post it on um, Bright Space. Thank you. Thank you for letting me know. Sometimes it's hard to correlate to cameras, to make it work. So we saw the shape of the mandibular premolar, first premolar, right? It's the line angles are more narrow, right? So don't make the tooth look too wide, okay? So my buccal surface, it's pretty much built up, more or less, but I'm very close to the shape that I need to be. All right, so now I'm gonna move on the lingual. So again, keep in mind and always keep, if you have, keep in front of you the tooth that you need to copy, and time to time take a look at the cusps, how the cusps are uh, developed and where they are placed, and try to copy the same, okay? So on the first premolar, mandibular first premolar, we have a very small mesial cusp, okay? So we want to make sure that we don't make that cusp too high. Why that would be a problem? Hmm? If we make that cusp too high, will interfere with the occlusal contact. Therefore, the patient will not be able to close their mouth, right? So they will have a hard time in functioning, chewing food, speaking, all that fun stuff. So from time to time, I'll stop and I'll take my opposing arch and I go and I'll put them together, okay? If this case will be mounted on an articulator, I will close the articulator. So I will do the up and down movement and also the lateral movement, because this is very important. When we chew, we don't chew just up and down. There is a whole movement that takes place, up and down, and then the lateral deviation, the lateral movement, okay? So you can see that actually when I did the up and down and the lateral movement, it left a little indentation. The upper premolar cusp left a little indentation in my lower premolar. So that showed me where the area it's very high. So I need to modify that, right? To carve it, okay? Again, always look what tooth we need to copy, and also look at the alignment. What I mean by alignment, how the teeth are aligned on the lingual surface and also on the buccal surface. So we don't want the tooth to stick out too much, or on the lingual surface to be too bulky, okay? So once I have my shape pretty much where I want it, I can take my die out and smooth the surface, the mesial and distal contact surface. And then I'm ready for carving. So I always start from the margin and take out the excess wax. I don't like to have, and it's never good to have bulky margins, okay? That's gonna interfere with the gums. So where we leave, if we leave a restoration that it's bulky by the margin, it's gonna push the gum away. And that has as a result, the gum shrinks, or even worse, it become inflamed, and the patient is going to suffer. Also, food can get impact in there, so we develop problems that they weren't there before. So we have to be careful with the margins. Always pay attention how we finish the margin. We don't want any voids in the margin, but also we don't want the margins to be too bulky to interfere with the gum. Okay. So I adjusted my margin, and then I'm just gonna go ahead and smooth out the surface a little bit, where I see that my wax it's a little is not smooth, and then I can put it back in my model and check for the anatomy and redefine my anatomy. So now on the mesial, we have this little cusp there. So I'm just gonna redefine my mesial lingual cusp. Okay. And then I'm gonna go ahead and concentrate on the triangular ridge and also the distal aspect of my premolar. Special attention must be paid to the marginal ridges. Why? Because the marginal ridges can interfere with the occlusal contact. So if the marginal ridges are too high, right, the patient cannot close their mouth. So that's a problem in function. Make sure you define your triangular ridges and your marginal ridges so you can see them. And also make sure you put your fossas in your grooves. So now that I have my shape pretty much where I want it, I just need to pay attention a little more detail on the cusp and the inclined plane of a triangular ridges, and then I should be done. Please make sure to check your occlusal contacts with the opposing. So like I said, if it's a mounted case and it's articulated, just close the articulator. You can use um, articulating paper to see where it needs to be adjusted. So okay? And also for, okay? So we can use the articulating paper, close the articulator, and then we're gonna do the up and down movement and the lateral movement, okay? And then we're gonna carve only where we see that we have a little mark from the articulating paper. Also, to check for the mesial and distal contacts, I like to use floss that I can put it in between. And if I hear that snap, that's how we want it. The contacts to be a little bit tight to hear that little snap, okay? So I'll just take it out. I'll verify that everything is nice and smooth. There are no rough spots or voids in my wax. All right. I look at the anatomy. If I need to re-emphasize my anatomy, this is the time to do it. Okay. So you can spend a little time in um, redefining your anatomy, but it's pretty much done. Okay, put it back. One last check. Always want to make sure that the embrasures are open, especially the gingival embrasure, because the patient has to be able to floss. So that's why I like to check the contact with the floss, because this is what the patient is going to do. And if the embrasures are closed, especially the gingival embrasures, that's going to create a problem for the patient. So they're not going to have a good oral hygiene. Check again with the articulator, with the opposing, make sure that the back teeth are touching, they're occluding, and that's about it. This is the wax up. All right.